All right. Hello, everyone. Welcome to the premiere episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade. I am a naturopathic doctor, and I'm very pleased to be joined today by one of my local colleagues here, Dr. Jason Plotsky. He's a doctor of chiropractic, and he's going to introduce himself because as I said just before we started recording, I could say lots of really nice things about him, but he can fill in a lot more of the details than I can. Just before I turn over the mic to him, just to clarify, everything that we discussed during this podcast episode is for informational purposes only. Nothing should be construed as medical advice, and please consult with your personal healthcare provider before making any medical decisions for yourself. So with that out of the way, Dr. Plotsky, if you wouldn't mind just giving us a quick introduction, that would be wonderful.
Super quick, and I'm super happy to do this with you, Brian. And we could say lots of nice things about you too. So I'm a practicing chiropractor here in Halifax, Nova Scotia, and practice with my wife, Cindy. And we've been here in the city for 19 years. May will be my 20-year practice anniversary.
Wow.
So I feel like that's a big one. And we love practicing here. And one of the best things that I found being I guess in practice as long as getting to know people like you too, and being able to refer and be able to help figure out tricky cases together, because I really feel like, we often can't do it by ourselves. So I'm very grateful for having you as a referral source, and you've helped out so many of the tough ones. So very happy to do this for you.
Oh, well, thank you. And thanks for those words. And yeah, anytime I see, who referred you, it's, someone from Nova Spinal Care. It's like, oh boy, I better make sure I ate my Wheaties that morning, because, it's not going to be an easy referral, but that's okay.
Yeah.
It's all good.
We trust you a lot.
Well, thank you. And ditto. I send my challenging cases your way too. Actually, I just referred somebody today, and she's quite a doozy of a case. So good luck with that. I refer like slightly guiltily sometimes, like, oh, this is not going to be an easy one, but
yeah,
it's what we're in it for. So
exactly.
Well, Jason, I know that you work with a lot of patients suffering from complex chronic illnesses like fibromyalgia, chronic fatigue syndrome. And I'm just wondering, like, outside of those, types of diagnostic labels, could you just mention some of the other types of conditions that your chronic illness patients have been diagnosed with beyond, say, fibro or CFS?
And like broad scope chronic illness, or like even like chronic spinal stuff?
I think more within the context of folks with like, not so much like, complex spinal things, but more like folks who have diagnoses like, say, like the fibro, the chronic fatigue, rheumatoid arthritis, that kind of thing. I think
and some of the autoimmune, like there's a lot of things, and there's stuff that comes to me from other practitioners that they actually don't even have labels. So you would probably give them the proper label. And for me, I just often, we call them sensitive, right? So they're people that, they've tried lots of different things. They're sensitive to almost, any intervention. And in the chiropractic world, those people are really tricky, because I find you have to not start too quickly, and you have to have a big bag of tricks. And I find some of my colleagues too will send those types of people to me, and often I can't help them either. But you would have named the top two or three for sure. I think people use the fibromyalgia term a little less, but if I think back 10 or 15 years, that was a lot of the people we would see, or people that had like just even chronic pain. They would just be labeled with chronic pain, and people not know what was going on, and they would be referred. They might have had 2 or 3 car accidents, and their body now is just exhibiting all kinds of weird, almost neurological type symptoms.
I know a lot of the folks who follow me on social media and will likely be listening to this type of podcast. They'd probably have diagnoses like, or wondering about diagnoses like, say, chronic Lyme disease or other chronic infections, chronic Epstein-Barr virus, mold illness, heavy metal toxicity. Do you have, amongst your more complex cases, do you have patients who have those types of labels?
Well, and they probably have some of those things, and they probably haven't had them, diagnosed properly, I guess, if you will. I find I will see a lot of the people, if they haven't seen you or people like if they haven't seen a naturopathic doctor, I find that I know something's up. but I don't have necessarily the tools or the skill set that can properly diagnose them. So it'd be, conversation might go like, okay, let's do this, and this because it makes sense. But at the same time, let's try and get you here so that you can see if there's something else that you should be doing. So I don't see a ton of like the people that either have those labels or, it would be a smaller percentage, I think, of my caseload now than it might have been years ago. I don't know if that's COVID related or whatever. I've seen, it's also, it's challenging too when you've got a bit of a wait list maybe for people to get in, and maybe they go somewhere else, right? So they are tricky, and I know a lot of the times whenever those people that we co-care for, when they make progress, oh my gosh, it's amazing, right? And I'm always amazed that they've been struggling for so many years, and just amazed at the human body. If you give it the right things, that it can still recover or even partially recover. It's amazing.
Mm-hmm. Well, let's say just using the labels of say fibromyalgia or CF, like
Yeah.
myalgic
Yep.
encephalomyelitis slash CFS, and then assuming that many of those folks probably have some of those underlying diagnoses like mold or Lyme or metals or what have you. So sort of within that subset of your patient population, um, are there? Sorry, just trying to read my question list here. First interview. So here we go. Um, right. So in terms of the other patient or the folks that you do work with that have those chronic illness labels, like CFS or fibromyalgia, in addition
Mhm.
to the treatments that you offer, what kind of therapies do they typically come in saying like, oh, I'm seeing, X, Y, or Z other clinician, like whether it's an acupuncturist or it's a
Mhm.
physio or it's a naturopathic doctor or maybe a functional medicine doctor or whatnot. What are the types of therapies that outside of what you offer that those patients say they typically benefit from?
Yeah, so usually, say the fibro group, they almost always have a massage therapist, but they're typically very sensitive to, massage techniques. I see a lot of those people often have maybe an osteopath as well. And the way we take care of folks, where everything's on the very gentle end on the chiropractic spectrum, where we're not using manipulative techniques in our clinic, those people tend to do well with what we do. And usually with massage, they don't typically do fantastic with like deep, heavy elbow type pressure.
Hmm.
So besides like naturopath, we always hope that they're seeing somebody like that, because that for me, it makes my job so much easier, right? Because I now have like a pretty long checklist, but if I know they're seeing naturopath, that takes a lot of the checklist away,
Hmm.
right? So typically I don't see a lot of people here who have a actual functional medicine doctor, or say a family practitioner that is deep into that stuff. I don't think there's a lot of people around here, so I wouldn't see a lot of those.
Hmm.
Some acupuncture. I think Nova Scotia is quite conservative with a lot of that stuff, so I still have a lot of people asking me like, does acupuncture actually work? Is that something I should try? I'm like,
Uh-huh.
listen, we've had Dr. Michael here in our clinic for like over a decade, and some of the stuff that he can do is just amazing with acupuncture. So I would say most of those people have tried stuff like physio. A lot of them have a massage therapist, or they've tried osteo. Most of them have tried one or even two chiropractors. So there's usually a pretty long list, like once
Hmm.
they come in.
Right.
Mhm.
And in terms of say non like physical therapies, like would they frequently say, "Oh, when I changed my diet, that seemed to help," or
Yeah.
I don't know, like I know in my practice, like if I had to list one supplement that's made the most impact for the most people, it's probably magnesium, for example. Like that's a big
Yeah.
more common game changer than like molybdenum or chromium or something like that. So are there just any like little things like kind of non-physical therapies that come to mind where it's like, oh, when I'm doing the intake with someone, it's like, oh, they mentioned that X, Y, or Z seem to have been uh, just more common things that are helpful or things that are more commonly helpful.
Yeah, and usually they would have, I think, the intakes take a little longer with those people because they do have a long list of things they've tried. And even like you said, magnesium, it's like they've tried 6 different forms of magnesium from 6 different companies,
Oh yeah.
right? And there's
Yep.
one that does the best for them. Or they have I find they have very particular, set or subset of things that work for them. And usually if you can find, what I found is that if you can find something that works well for them, it's like, it will typically work quite well for a period of time. But 100%, yeah, they'll have, like a long list of whether it's homeopathics or different herbs or the right concoction of those things, or absolutely, there's always a pretty long list.
And just maybe circling back a little bit, I might have put the cart before the horse a bit, jumping into these questions. Would you mind just quickly speaking to the type of chiropractic technique that you work with?
Yeah, so we got trained in Iowa at Palmer College of Chiropractic, and so when you're there, you learn a toolbox, if you will. And one of the techniques that you learn in the core curriculum is an upper cervical adjusting technique that they used to use like in the 20s and 30s and 40s. So a lot of people think, oh my gosh, that's so old school, but um, there was a chiropractor who was an engineer as well that developed a more refined version in the 60s, and so he labeled it NUCA, NUCCA. So when we graduated, I was primarily, that was like 90% of what I did with my patients in my extern clinic at the school, and we did a preceptor program, and that's the chiropractor I went to work with. That was 98% of what he did. So when Cindy and I came out of school, and Cindy did her training also at Palmer, but we did intern programs at different states. She did hers in Oklahoma. And I went to see, where she was working, and it was unbelievable because people were traveling 4, 5, 6, 7, 8 hours, like each direction sometimes. There were students from Iowa that were driving to Oklahoma to see this guy.
Wow.
And so, I'd heard about it because there were some Canadian chiropractors from, or chiropractic students from Calgary asking me like, oh, have you heard of NUCA and this? And I'm like, no. So when I looked into it, it really spoke to me. When I was adjusted the first few times, I was laughing because, it's like you're barely putting pressure here and at the top of your neck. And I remember the first day, like it felt like somebody had literally picked my head up an inch and I could turn it more. And I was a person with chronic low back pain, which is always the interesting, connection between how the body's so interconnected. And by working on my neck, it really helped my low back. I mean, it didn't like fix it by any means because I had already started chiropractic school with some degeneration in my spine just from so many years of baseball. But the upper cervical technique opened my mind to the possibilities of how, we can work with people in many different ways, and that there's no right way, there's no one way. But this, for us, it just spoke to us in different ways. For me, from a mechanical point of view, or, I could literally look at a person's posture or an x-ray and you can literally decide, okay, this needs to be less tilted, or, you could posturally see with people if the head was tilted one way, that one shoulder was higher or lower, or the hips were higher or lower. And very early on in our practice, we were seeing pretty amazing things from just primarily working with the alignment of the upper neck, because if that got sorted out, it would have these interconnected, other adjustments. So you could work with the pelvis with some of these people by just gently working with the neck if you could move things in the right direction. So, from there, we took some other techniques because we still struggled with some of these difficult cases. So we practiced some instrument adjusting techniques. So activator is a very common chiropractic technique that people will learn. And there's torque release is another instrument adjusting technique. And these things work more with the nervous system than they do like moving bones per se. So there's no cracking or popping with any of those techniques. And I'd say in the last 8 to 10 years, I started getting more of these like really chronic low back disc issues, very complicated, stenosis, sciatica, a lot of these like difficult to treat and very sensitive to treat kind of conditions. So we invested in some technologies. So we have decompression therapy here. We use flexion distraction tables. So these are tables that someone lays face down and the table gently separates, so you can, really work with chronic either facet conditions or chronic disc conditions. And again, there's no cracking, popping, or twisting. So it's, people that love the traditional adjustment, they probably don't love what we do. But people that don't love the traditional adjustment usually get along really well with our kind of, more gentle method.
Mm-hmm.
So that's a long answer to your question.
It's a good answer.
But we do lots of different things, right? So it's all hands-on, and
Mm-hmm.
it's really, I like to think when I see a new patient that there's probably a technique or a series of techniques or a combo of techniques that's going to work well for them. And that's what I really enjoy in practice still, like after all this time, is trying to figure out what works well with each patient, because it's never the same. And you could have two spines that look exactly the same on an x-ray and they respond completely different to different modalities. So it always keeps us on our toes. That's for sure.
I have lots of empathy for you because it's the same in
Yeah,
my world, different
exactly.
playing field, but yeah,
Yeah.
absolutely.
Mm-hmm.
And just speaking from firsthand experience, where you've treated me several times over the years, it's just, it barely feels like you're touching me, and yet, it's there's definitely like there's a very obvious physical impact. I notice it shortly
Yeah.
afterwards. I'm really sensitive to changes in my body, so I feel things like on the table, but even just objectively, as you were saying, like I range emotions better, this and that. So
Yeah.
it's pretty profound, and like as you're saying, like just barely touching, like it's I mean it's
Mm-hmm.
and it's not so subtle that and I know I'm just saying this for folks listening, obviously what you do, but just as
Mm-hmm.
a person who's been your patient, it's not as subtle as, say, folks who might do something like maybe craniosacral technique, where it's like, oh,
Yeah.
like, or you're just barely grazing me. Like there is some pressure, but it's
Yeah.
so incredibly non-invasive. My wife brings our 4-year-old and 6-year-old and she's been taking them to see Cindy for at least a few years now, and like just not
Mm-hmm.
even a hint of concern about the quote unquote aggressiveness of the therapy. Like
That's right.
easily do it
Yeah.
on a baby, like just really really gentle, which I really appreciate.
And it takes that, the safety issue like right off the table, right?
Hmm.
So when we're working with people, like we know, like there's people obviously we can't help, and there's people that we've tried to help and that didn't get help, and we always feel, it always sucks when you try really hard, right? Same for
Hmm.
you, but
Hmm.
yeah, the safety issue is just, it's good to get that out of the way. And I like I'm kind of nerdy, I like to visually see postural changes. I have people stand on two scales, so I can, we can get those things to change without using a lot of pressure or force, which is really hard to believe. And if I didn't have those tools here, sometimes I would find it hard to believe that it's moving or changing.
Hmm.
But again, before and after, maybe not every adjustment, but every other adjustment, or in a lot of cases, before and after, like an adjustment, you can, I can put someone on two scales, see that they're off to one side by 10, 15, 20, 30 pounds sometimes. And
Hmm.
we can get them not perfect, but often within a percent or two of their body weight. And
Hmm.
then if you can figure out how to keep it there, then over time, it's unbelievable what the human body can do when you remove that type of physical stress.
Hmm.
So,
Yeah, no, it's pretty profound, and
mhm.
I really appreciate having you folks like just so close down the road to our clinic. It's so
Yeah, it is
convenient,
great. We're
like
like
distance
seven
wise. Yeah,
minutes
we're
away. Yeah.
pretty much neighbors, and
Yeah.
and it's just really great because I've had so many patients where, as you were touching on earlier, like they're just so very sensitive to things, like sensitive to supplements and foods and this and that, and sometimes they've maybe had a less than favorable experience with more traditional like manipulative types of chiropractic, or they're just nervous about things, justifiably so. And so it's
Yeah.
really great to be able to say, if you go see Jason or Cindy, like it's going to barely feel like they're touching you. It's very very gentle. They have lots of other tools and gizmos, which I'm going to pick your brain about in a minute.
That's fine. Yeah.
But it's really great. And then as you were alluding to, there's other patients where like you just know that they much prefer a more sort of traditional chiropractic approach, and so I have my folks I refer to for that, and it's
Exactly.
just really
Yeah.
nice to have the spectrum of options.
100%.
Yeah.
Yeah. I agree 100%. And same for me, like our front desk staff is trained too. Like if we have people that are transferring, moving, and they're
Hmm.
just like, oh, you're the closest chiropractor. And because 90 whatever percent of our patient base is referred. So we do get the odd person that either walks upstairs because they're on a walk, or
Hmm.
they're just moved into the neighborhood. And those people, we have a list too of friends of mine that are, within 5 kilometers of here. So
Hmm.
we know we're not the end all be all, but for the people that, have struggled, we can definitely be a good option.
Yeah, that's great. And,
Mhm.
and one question I have for you is with my social media following,
Yeah.
I know there's folks from all over North America, some from other
Yeah.
places in the world too, and I'm just wondering if someone listening to this thinking like, oh my gosh, like I want to see Dr. Plotsky or Dr. Toner, but
Yeah.
I don't live in beautiful Nova Scotia.
That's
Um,
right.
uh, if they want to find someone who practices in an analogous way, are
Yeah.
there certain keywords they should look for on a person's
Yes.
website or?
The NUCCA website is a good place to
Oh,
start. So
okay.
like nucca.org,
Hmm.
and they have a listing of chiropractors in North America and abroad that practice like the gentle upper cervical technique. Um, we also did some extra training with a doc in Atlanta, Dr. Russell Friedman. So his technique is called QSM3. So
Okay.
he also has a website and a listing of practitioners. And his is just like an offshoot. So there's a lot. There's a bunch of different chiropractic techniques that are very gentle. The way we practice is just those would be the best places to start.
Hmm.
But thankfully, there's always options for people, right?
Hmm.
So even just Googling like gentle chiropractic sometimes, and then the name of the city, then
Hmm.
you'll often get a start. Activator technique is like very gentle, right? So
Right.
they would have a list of practitioners and people that are certified. I think torque release technique has that as well,
Hmm.
like a listing of people
Hmm.
that have taken courses at least.
Hmm.
Yeah.
Great. I'll
Mhm.
put those links in the show notes, and so if
Yeah.
folks want to check that
Great.
out. But
Yeah.
that's great.
Yeah.
Um, and just out of curiosity, are you still using the ArthroStim?
Yes,
Yeah.
love like
Okay.
all the time. It's
Yeah.
right here.
Lovely.
And they're fantastic. So again, the instrument adjusting techniques,
Hmm.
I love them.
Hmm.
And especially when you're thinking about, again, in a concept of not necessarily moving a bone, but in terms of stimulating the nervous system in a certain way or in a certain area, that can be really profound for people too, in terms of, say trying to enhance the effects of the parasympathetic nervous system versus say the sympathetic nervous system. Like you can actually, with these instrument adjusting techniques, I think that's also part of how they work, is that they
Hmm.
help, reduce that sympathetic tone in the body, which, has these profound effects on everything else. So yes, I use that a lot, and we test it out with people, right? So if someone's like I've had ultra sensitive people do fine with, mechanical instrument adjusting, or, you know, cupping or scraping or things that are like soft tissue based. And I've had other people, you can't even touch them with stuff like that because it will just set them off.
Great.
But sometimes it's like, it's an option. So I'll try it and just let them know, like, this is something we can use. We don't have to use it. It's worked on other patients. So I'm always just trying to gauge a person's body and
Hmm.
not try and overdo it. I
Hmm.
think that's something I've learned with that patient base too, is that more is not necessarily better,
Hmm.
especially when it comes to force or, working on areas of the spine. It's just sometimes keeping it very simple can still have a very profound effect on the body.
Hmm.
Yeah.
So for those patients where you need to take that less is more kind of approach, like that ultra gentle approach, I know you folks use a frequency specific microcurrent, and you have laser, and you
Mhm.
have
Yeah.
PEMF, which is pulsed
Yeah.
electromagnetic field therapy. So
Yeah.
of those other gadgets and gizmos that you've been accumulating over the course of time, I've
Yeah.
noticed, what are some of the ones that you found to be the most helpful for folks that are in more of that like fibromyalgia, chronic fatigue
Yeah.
sort of
Yeah.
umbrella?
Well, and we've got a lot of the red light systems now too.
Hmm.
So I've found that to be. I'll try that first because I find with a lot of those folks, the infrared, like the heat from the infrared, is just very soothing to their nervous system. And the red, even though it's bright, and they can wear goggles or glasses or whatever they want, but I find the anti-inflammatory effects of the red light are really strong. Like I've been using laser in our practice since 2006.
Hmm.
And so we took a course from Lance Armstrong's chiropractor, and he was here in Nova Scotia doing a training, and he did some really cool things in a very short amount of time with laser.
Hmm.
And he said, if anyone's interested, I have this course, and I bought that. And that's actually how I found out about the frequency specific microcurrent, because he was traveling with that, with these athletes, these
Hmm.
world-class athletes in France and Italy. And he had them hooked up to laser. He had them hooked up to frequency specific microcurrent. And at
Hmm.
nighttime, he had them grounded. He was
Hmm.
telling us stories how he would like take copper wires and like put them in the earth and then put those underneath the mattresses of the athletes to ground
Nice.
them at nighttime.
Hmm.
And I remember asking him, like, is any of this stuff in like papers, or is it like, valid? He's like, when you're in my position working with world-class athletes, you have to be ahead of the curve. And so, he taught me FSM, and he taught me about the laser systems. And so we still use, like, got, that the black laser there, like
Right.
that's an Erconia laser that we have been using for, well over 10 years.
Hmm.
And while the red light's newer to the practice in the last year, we've had FSM since 2006 as well. And so those types of things that are very specific, I find them very interesting, but they too can also be super overwhelming for the body. Like even on the lowest setting, I find the FSM for some people, it can be amazing because it targets the tissue specifically that you want. And in the same breath, because it targets that tissue so specifically, even on the lowest setting, which is like 1/1000th of like, there's so little electrical current going through. It's like 1/1000th of a light bulb,
Hmm.
but it can be enough to set off the nervous system.
Hmm.
So we try it. And so basically, I try and read people based on, what has worked, what have they tried, and I just always start in small amounts and we'll work up. But I would say for if someone came in today, and what I'm doing today is different than I was doing last year or even 2 years ago,
Hmm.
I do try them on the PEMF machine. We've got the big, circular magnet ones that, because most of the stuff we would see, we can stick their body part of concern inside, or usually it's their head, because we're really trying to, have effect on the central nervous system.
Hmm.
Then I can turn my PEMF down to like, on my setting, like 1% or 2% of its max. And for some of those people, that's too much. And for other people, that is the thing that really resonates with their body and their nervous system. And they do really, really well with it. So I tried different things, and I try one thing at a time. I find that that's good. So if I try on day one, like a test adjustment, then see how they were on day two. On day two, if that was okay, I'll try a test adjustment and maybe like a minute or two of laser or a minute or two of red light. And even though it's like so small, you're probably not making a big physiological change. It's enough to test, right? And then on day three, if that was okay. And so for me, I kind of layer things and
Hmm.
try and figure out, okay, what is going to be the real concoction that's going to help this person the most? FSM is quite complicated to me, so I usually leave that to the end, where Cindy kind of jumps to it.
Hmm.
So we practice a little bit differently that way. I like to think of things that I know for sure are having a physiological effect. So if I stick somebody in front of the red light, I know it's doing something, right? They may not feel it, but it's definitely doing something. With FSM, they have to be hydrated. You have to have the right setting picked. So it takes a little bit more digging, and you got to be really sure that you have the right setting.
Hmm.
And on the PEMF machine, if I put somebody in at a certain frequency, then I know it's having an effect on the system. And lots of studies that have been done on mitochondrial function and ATP. So if we're trying to make a change at a cellular level, which I think we're always trying to do, when
Hmm.
I put somebody in front of a red light or after an adjustment, I use the PEMF, I know it's doing something, whether they can feel it or not.
That makes sense. And so with
Yeah.
that type of approach, like say if you're just doing, paraphrasing here a bit, but if you're kind of just doing like a
Yeah.
little bit more, like a new thing each time,
Yeah.
like are folks coming in, like how often are they coming in to see you kind of in those, like let's say someone's, super
Early, brand
sick,
new
like
patients.
yeah, brand new patient, they're like super sick, like super
Yeah.
sensitive, like
Yeah.
debilitating chronic fatigue or something like that. Like
Yeah.
how often are you ideally getting them in?
Once or twice a week.
Mm-hmm.
So, once a week I find if someone's like uber sensitive and you can only do so much and it takes them 2 or 3 days to recover, well, then it's like doing a workout too close together. You don't actually receive any benefit, I find.
Mm-hmm. Yeah.
Some of those patients, I might adjust them once a week and then bring them in another time a week and just do a modality and
Right.
test that with their body. And
Mm-hmm.
some of those people actually do okay with that.
Mm.
So if I can find, I guess my job in the beginning is I'm trying to find the adjustment protocol that's going to work with them, but I'm also trying to maybe find a modality that will help speed up the healing process, but also not screw it up.
Mm-hmm.
Because sometimes I go through the modalities and they're sensitive to all of it. And then I just go back to, okay, I'm going to try and give them the perfect chiropractic adjustment if there's such a thing.
Mm-hmm.
And just like let their body and their nervous system just take that, sort it out, work on the healing process. And, hopefully they have somebody like you in their back pocket and figure out any other, conjunctive therapies or anything else that might help them out.
Right.
But usually twice a week I find is like a sweet spot for most
Mm-hmm.
people. If somebody comes in and if it's more like chronic spinal stuff, I will see occasionally some of those people 3 times a week. But same thing, like sometimes they're just recovering from their last session.
Mm-hmm.
And there's a fine line between, creating momentum and, really not giving their body a chance to respond.
Right.
So I try and read that a little bit, but usually 2 times a week is a sweet spot to start.
Okay. And just to clarify for folks listening, a modality is like, using a tool like the PEMF for the red light or FSM or whatnot.
Yeah.
So just
Like an adjunctive
way.
therapy, something over top of their adjustment. And for some of those people, and I do manage like a lot of my caseload. I have a very wide scope, everyone from kids on my baseball team to, 85-year-old, people with scoliosis. So some of those people, if they're really sore too, I find like I can bring them in for additional adjunctive therapies, and I might not be able to see them just the way my schedule is, or just like I'm booked, but they could benefit from something like that. I found that to be working really well lately as well. If somebody's, chronic or they're in a flare up, because we see a lot of those people, then sometimes doing a red light like 2 or 3 days in a row is okay, even if I can't see them each time.
Right.
As like with a chiropractic adjustment. So that sometimes helps people too.
Right. Which, just out of curiosity, like, because when you're saying red light therapy, like you're referring to like LED red light, not laser?
Yeah, like BioLight, Platinum.
Which system do you have? Just like we have a BioLight at our clinic. I was just curious. Oh, you have a couple of them.
Yeah.
Okay.
I have like, we have both. So I have like the small BioLights that we test out. I have the large Platinums. Those have been working really well.
Okay.
I have a small BioLight at home and a large Platinum that sits on the back of my bathroom door. So I'll do like cold shower, red light kind of combos, really helpful. I find a big difference if I don't do it in the morning. If I do red light in the morning, like mentally, I can tell, and I feel like it's changed. It's helped with my vision. Like I'm turning 47 this month, so I'm not going to say that, everything's going downhill, but my wife would laugh at me because I would, she put something in my face and I'd have to like back up to read it. And I found since I've been doing, because they sent something out, they said like 2 minutes, for like visual things, it can be very helpful. So I've been doing that, and it definitely has made a difference. And cognitively, for me, I just feel more alert. Like I try and do a really good job of like getting outside in the morning. But if there's mornings I can't do that, I'm feeling a little slow and groggy, go in front of the red light and I feel like $1,000,000 after 5 minutes.
That's great. What for the vision treatment? Like I'm assuming you're not looking at the light.
You can, I just don't look directly.
Oh, okay.
So, I'll look like off to the side a little bit.
Oh, okay.
But the last thing, I think either BioLight or Platinum sent something, and it was like a protocol. It was like 2 minutes a day.
Okay.
Red light was, it helped with a bunch of things, and visual acuity being one of them.
Huh. Interesting. Well, I'm gonna have to give that a try with ours because I did not get that memo. If it was from BioLight, I didn't get the memo, but
it might have been
really
from Platinum then. Yeah, yeah. It was just like this last month. So I remember seeing that in the BioLight, like in their book, like in their protocols book. But yeah.
Yeah. they've got about a million protocols in there.
Exactly.
They
Yeah.
just crank them out all the time. But
Yeah.
um, well, I just have a couple more questions for you if you're still
No problem.
okay for
Yeah.
time.
So good. Yeah.
Earlier, where I was asking you, are there certain treatments that folks with chronic illness have, more benefited from on average, maybe more than others? I'm also wondering, are there therapies, whether they're physical therapies or certain supplements or certain, non-physical treatment approaches, shall we say, that you found either interfere with the work that you do, or that you find patients just don't really seem to benefit from, like kind of, swings and misses, just out of curiosity?
I think, and there may be things that interfere. I try really hard in our practice. Like I remember I would go watch these NUCA doctors, like I've had 10 or 15 people work on me, and it always feels different, which is always amazing to me too.
Mm.
Like these people that, we're supposed to all have the same training and all this, but, um, and some of these people would hand out things, and they'd be like, you know, having their people like back into the parking lot so they wouldn't turn their head after an adjustment, and don't get your hair washed, and don't do
Oh,
this and
wow.
don't do that.
Wow.
It was a pretty long list. And so, like, I know how sensitive this area is, but I don't want people to feel like it's that sensitive where they can't, live their life. Right.
Mhm.
And I definitely have some people that like, will work on them and they'll do something small and like lose their correction somehow.
Mm.
Um, so I try, and early on in practice, we were pretty particular about doing massage first and then an adjustment, so that I would be the last person to touch them, so to speak. So like there's compensatory muscular things that will happen after an adjustment. And sometimes that's not always a bad thing, right? So if somebody's, chronically shifted a certain way and their muscles are used to being a certain way, and we can help them get to a new way, those
Mhm.
muscles are going to function differently. And sometimes we, used to think, okay, we don't want to mess with that. I think it's less like that now. I don't find that, like I can't remember the last time I said, oh, geez, like Mrs. Jones, I got you great, and then this person screwed you up. Like, why did you do that? I think people
Mhm.
screw themselves up. Like they'll do silly things and not take breaks from something and put themselves in bad positions and drive, too much without taking breaks. Like I think people do that. But in terms of, like a supplement or a modality, or, besides traction or things to the spine, um, there's not a lot that a person would do that I would come back and say, well, why'd you do that? You screwed it up.
Mhm.
So, in terms of swings and misses, I think, man, you would know more about the supplement side of things than me. I am very basic. So if I have a patient that hasn't seen you or another naturopath, like we're checking for magnesium for sure. We're checking for omega-3 status. We're checking for vitamin D. We're checking for general, like what do you normally eat? I'll ask people what they eat for breakfast, those types of things. I'll check on their water, make sure they're hydrated. These days, electrolytes seem to be, really important for people.
Mhm.
But beyond that, um, probiotics or something else if they have a lot of like digestive issues. But I don't go through like a 20 list of supplements. I
Mhm.
find homeopathic things for people would be maybe one of those swing and miss things,
Mhm.
but not something that would interfere. I'm
Mhm.
just always interested and curious. Like if someone comes in and they say, I took this homeopathic and whether they say they were terrible or amazing, I'm always interested.
Sure.
Like, wow, because that's almost nothing. And it did that, you know?
Mhm.
So, on a nutritional kind of component, again, we call them like the 5 essentials. And so we try and make sure that people have those bases covered. And if they need more or different things, that's always where we leave you guys to make those types of recommendations. And,
Mhm.
maybe the homeopathic stuff, I know very, very small amounts of it. So I don't usually recommend a ton of that stuff, but if they haven't tried it, then, we'll send them down to the health food store, or, back to you guys, and see if there's anything else out there that might be helpful.
Mhm. Great. And so for folks who are within driving distance of your clinic, aside from working with you or with Cindy one-on-one, are there any other ways that you work with folks who are, in Nova Scotia and surrounding area?
Yeah. So like, especially lately, like after COVID, we just found it really challenging to get any health information out there that wasn't, COVID related. So I
Mm,
started recording some content, and longevity to me, it means something. It's different for everybody, but a lot of my patients, I'm watching them and looking at them going, are you going to be able to do the things that you want to do in 5 years or 10 years or 15 years? And so I have a lot of patients over 40, over 50. And so over the years, we started to try and compile these, I call them checklists. So just things that I would love my patients to be able to do. And after COVID, we started recording some of those things. So I created a low carb, like a nutrition program that I think is really good for people, like as a basic intro to, what I would say is a general safe nutritional approach for lots of different folks.
mhm.
My dad died of, heart disease secondary to diabetes. So, I would put myself still in that insulin resistance kind of category. So I tend to continue to eat that way. And then, as you did, I experimented with the keto, diet for a while. So I recorded some content around that I think is good. But now what we really try and do is, this longevity academy is something that we created last year, and it's still in its beta group, but it's an online learning platform where I go in once a month like this, like on Zoom, and I do live Q&A. I have a community manager, so she's there answering questions, and I have a ton of content that's basically in 6 different pillars. So I've recorded content on nutrition and this basic supplementation, mobility, so like different stretches, different exercise protocols. I have information there on sleep. And then my last one, it's kind of the big one, is like stress management. So those are what I would kind of focus on with our patient group, those 6 pillars. And like I was telling you, I'm currently writing a book
Mhm.
that's focused on those 6 pillars, but also about the mindset. So we try and talk to our patients, a little bit about that in the practice, because I find, as you probably find too, if somebody comes to you with, they've had chronic illness for ever, there's a certain mindset that's going to be required for them to get past things, or there's a certain mindset that they're going to need if they improve for a period of time and then they crash,
Mhm.
right? Like you have to coach people. And so what I found with some of these people that were from a distance, or, my patient's sister, like some of these people are in that group, and it's a low cost, it's like less than $30 a month kind of program.
Mhm.
And we can answer questions, and it's all the non-chiropractic stuff that I want my patients to be able to do. And we encourage, our patients, if they're the type of people that like learning and they can handle the online platform, and that's definitely not for everybody, because
Mhm.
I think people got zoomed out after COVID a little bit.
Oh yeah.
But we post new content in there. We answer questions. We do live Q&A, and next year they can grab the book.
Amazing. If they
Yeah.
want to access, or well, you said it's in the beta phase. Like, can folks
Yeah. So
like
like
look?
drjasonplotsky.com.
Okay.
So I have like not just the Nova Spinal Care website, but drjasonplotsky.com is where those online programs live. I also put together like a men's health program that I recorded. It was a live workshop. It's over a year old, but the content there I think is really good. Like if you had somebody that was like, yeah, I want to improve my health,
Mhm.
and they like, what should I do? Or it was basically a synopsis of the non-complicated things that I do, like just things about sleep and workout regimes. And I recorded some, basic mobility patterns for hips, shoulders, low back, things that I would want, my patients to be able to do.
Mhm. Great.
Yeah.
Yeah, well, I'll put that website in the show notes as well. And I remember
Yeah.
it was out on the sign out by the Sante Center.
Yeah.
Jason works, owns this amazing complex that has, his clinic, physio clinic, our favorite farmers market, amazing health food store, coffee shop. Like, it's a little mecca. It's an amazing spot right around the corner from where I live, which we're very thankful you built
Yeah.
it, because it really saves us a lot of driving. My wife's in there like
Exactly.
at least a few times a week picking stuff up. So it's great. But I remember it being out there on the sign that you folks have, like, oh,
Yeah.
drjasonplotsky.com. And so, yeah. So
Yeah.
anyways.
Well, and I mean, I think there's a lot of information out there,
Mm,
and this is one of the obstacles that I think is like when people are looking for things is like, who do you trust, right? So um, I'm not the person that I don't have the end all be all, right? So all I'm trying to put together for people is like a list and a I guess a protocol in a way. So I've kind of developed in that Longevity Academy like a step by step type approach of here's here's a quiz first of all, let's see where you are, and
mhm,
then based on the quiz results, we basically classified people into a couple different groups. So like a really basic group and something that's a little more advanced.
mhm,
And then things that you and I would like to nerd out and talk about, those people, they're almost like beyond what's in the academy. So
mhm.
it's really like I have patients that don't know a lot about nutrition. They don't exercise a lot. They're not at the gym at all. Like that's, we call those people like you're level one. Okay, so here's what you need to focus on if you're in this group.
Mhm,
These are the things that will probably make the biggest impact with the least amount of time. And
mhm,
then once you learn those things, we can transition you to level two, which has more things to learn,
mhm.
more complicated things. But still, if you looked at what was in there, you'd be like, oh, these are great basic things. Like everybody should do these things. And that's how we kind of developed it is, for us, my interest outside of chiropractic is helping reduce chronic disease, right? So preventable chronic disease,
Mhm.
right? And the only way that I think we ever get to that is through lifestyle habits and doing all these little things right. And
Yeah.
so that's where the pillars came from is that, like we're not ultimately healthy if we don't sleep well and if we're missing some supplementation, but if we don't move or exercise or we can't, bend our spine or joints a certain way, like all of that is going to affect you in 5, 10, 15, or 20 years. So we try to put that all in like one place. So it's always evolving, which is why we're always putting new content in there. Um, but I feel like it's a great resource for people.
That's great. Yeah, super, super
Mhm.
important. So yeah, well,
Yeah.
thanks for sharing about that.
Yeah.
Very last question, just a quick one. So say
Absolutely.
someone's listening from, Hawaii or Denmark or like someplace far, far, far from where we are. And they're thinking like,
Yeah.
oh my gosh, like that Dr. Plotsky sounds like a really brilliant guy. And, I've got a chiropractor and I'd, really like to get Dr. Plotsky's input on my case. Do you offer any kind of like long distance consultation service, anything like that, or any
We're
options for folks?
starting to.
Okay.
Yeah, we're starting to. So
Mhm.
like, email, as you know, is very difficult and it's time consuming. So I
Mm,
find for some people, we are now just starting that process of, you know, if someone emails or they call the front desk, we try our best to like triage and
mhm,
determine like, is this a person I need to see? I do see people from all over Atlantic Canada, including flying in from Newfoundland. So not recommended like, oh yeah, just come for a day and I'll fix your spine forever. Like
uh-huh,
that's not typically what we are able to do.
mhm,
But I do, yes, phone consults with people like that. I try and avoid email as much as I can because,
mhm,
you know how time consuming that is as well. So,
mhm,
but absolutely, if somebody, if there's something I can do to help somebody out, we are able to do some of that remotely. I do some, again, not diagnostic, coaching or treating, if you will, but I do health coaching,
mhm.
which is more like, let's look at what habits you have in place and see what I might be able to do to help you out. And I
Mhm.
do offer some, one-on-one coaching services, but it's
Okay.
very limited because of just your schedule is like my schedule. And as we were chatting before, 3 kids that are active, like there's not a lot of room to do that stuff. But if I can be of any help to somebody, I would certainly try.
Fantastic. Well, that is great. Well, I'll put the in the show notes. I'll put the Nova Spinal Care website URL on there. So if folks are interested in
Awesome.
getting in touch with
Yeah.
Dr. Plotsky or Dr. Toner, for some of my referrals, I'm like, just go see whoever's the first one available. And then in other
Yeah.
cases, it's kind of I have a bit of a sense of the you each have a little bit of a different flavor to your practice. It's my understanding, and
Exactly. And
I've
they know
never
that too at the front desk. Like
right.
they're like, oh, this is a Jason person, or
Hmm.
this is a Cindy person, and we just take whatever comes and it all works out.
Fantastic. Yeah. Well, in all the years that I've been, either treating folks who have seen you or who you've referred to me or I've referred to you, I've never heard a bad review once, which is pretty darn good. So we've known
Oh,
each other
they're
for
out
quite a
there.
while. So, well, they don't tell me anyways. I'm pretty
Yeah,
intimidating, so they
exactly.
probably don't say it.
Oh,
But
we have
um,
no illusions. Yeah.
yeah, well, anyways, I've never heard anything but good things. So yeah, I
Okay,
appreciate
appreciate
having
that.
you as a colleague to refer to,
Yeah.
and thanks so much for taking the time to chat with me today. Is there
Oh, this
anything
is
you
super
want?
fun. Yeah.
Is there anything else that you wanted to cover today, or have we covered the
Well,
ground
not
pretty
to
well?
cover, but just like as a mindset thing, I always love to leave people, with the idea of possibility,
Mm,
right? And so, if I get somebody who's super complicated, I'll often say like, I may not be the person, but I do believe there is a person, a modality, a combination, something that will make a difference in somebody's life.
mm,
And so I always encourage people to like not stop trying.
mhm,
So I hate to think of myself as the last person,
mhm.
right? Because I really do feel that way, that like how many people have you seen where they said, I've seen everybody, and then
So many,
they see
so many.
you and you're one of the pieces. Or I'll have people that come in, they say, I've seen every doctor. And I'll be like, have you seen, and if they're local, like we can list them, right? I'm
Mhm,
like, have you seen this guy? Have you seen this gal? Have you seen this person? Have you seen this? I can make a list. They're like, nope, nope, nope. I'm like, well, then you haven't seen everybody,
mhm,
So or if people come in and say, I don't know if there's anything you can do to help me. So I really do try and focus too on people's language, right? Because I think that that's important, that we have to really address the mindset. And I'm going to, that's part of my book as well, is like addressing that for people. So making sure that they have a mindset for healing
mm.
and to never give up, right?
That's a great message. Yep, and I talk about the same thing with my
Yeah.
patients too. So on the same wavelength, which is
Yeah.
great. Yeah. Well,
Awesome.
thank you so much again for your time, and
My
yeah, it's
pleasure.
really always a pleasure
Anytime
chatting
you
with
want to
you.
do it, let's do it.
I appreciate it. Great. Well, thanks
Okay.
everyone who's tuned into the podcast episode, and we'll leave it there for now. And take care.
Okay. Thanks, bud.
Thank you. You too.